Hello, Sojourner Health Clinic volunteer. Welcome to Osler, an open-source, browser-based electronic medical record system developed at the Washington University in St. Louis by students, for students. Hello, and welcome to our video on creating a new workup. To create a new workup, you'll select the patient you'll be writing the note for. The top right, under Actions, you can select Write Note. You'll be brought to two note types. You can either select Standard Medical Note, which is the workup you're looking for, or Basic Note. Please see the Basic Note video series if you want more information on creating this free text internal memo type note for our ancillary departments. However, if you're seeing patients, all you need is the Standard Medical Note. We'll open this up. So when you create a new workup, select your attending. For other volunteer, go ahead and choose anyone who's been helping you out in clinic that day. For example, if a student was shadowing you, but you do not need to select yourself because you will automatically be assigned as the author of the note when you submit the note. For chief complaint, go ahead and put in what they came in for. This could be refills, this could be an acute complaint, whatever the reason is. For HPI, go ahead and do your standard HPI. Presents with lower extremity edema. Now we'll scroll down to past medical history, past surgical history. So you're welcome to put history into the HPI. However, because it's right below, you don't necessarily need to put it in the HPI. Keep your HPI for a very succinct yet thorough history of the present illness, and make sure to not be as brief as I have been. For past medical history and past surgical history, you'll notice that they were migrated from the previous workup. So obviously if this is the first time the patient's been seen or the first note, this wouldn't be there. But for all subsequent notes, all history fields are migrated forward. So you just have to delete the heading to indicate that you have reviewed the history and updated it. For example, if the patient mentioned, oh, by the way, I also have hypertension, you would include it there. Same thing with family history. You will highlight and delete the top heading if there have been no changes, and then you can either update, add to, or remove anything that's changed in the family history. Same thing for social history. Make sure to include smoking use, drug use, alcohol use, and all other aspects of the social history, including who they stay with, who they live with, their social situation, and be sure to update it appropriately. Same with medication list. Medications, this should be the running list of all the medications the patient is currently taking. So be sure to do a reconciliation with the patient and go over what medications they are currently taking. Under allergies, same thing. Be sure to update and make sure that the allergies are accurate based on what the patient tells you. For review of systems, so you'll notice that everything is blank in terms of organ system categories. Go ahead and highlight and delete the top heading to indicate that you have reviewed the review of systems. If there are no pertinent positives or negatives, this is what you would submit. But I think you'd be hard-pressed to find a patient with no pertinent review of systems, as brief as the encounter may be. So please go ahead and write in the appropriate fields. We are not a billing-based EMR, so you do not need to put in extraneous or unnecessary details. Stick with what's relevant, stick with what's pertinent, positives and negatives. As we scroll further down, we have our physical exam. The vital signs are something that the triage or intake students will provide for you on the intake sheet. Your job is to put that into the system, so you can go ahead and put in the blood pressure, heart rate, respiratory rate. If you got a temperature, great, and you can ask the patient their height and weight. If the triage student did not take care of this information, or if you do not have the sheet, it is your responsibility to ask these questions. Specifically, it is your responsibility to get the blood pressure. Then you'll go ahead and update your physical exam. Just like before, you can highlight and delete that top line to indicate that you have reviewed and updated the physical exam. This is a normal physical exam. Please document any abnormal findings. But as I've mentioned, we are not billing based, and you do not have to put in extraneous or superfluous details. Only put with what's relevant and try and make it brief and keep it accurate. As we go to the bottom, assessment and plan. You're welcome to re-include the one-liner from the top. For example, 30-year-old male presents with edema. However, this is not always necessary, as we are all viewing the entire note on one page, so this might become extraneous. Typically, however, you can just stick with the diagnoses. For example, we know that he has hypertension and what you're doing for his hypertension. So we're going to start lisinopril 20 milligrams daily. And then you'll also obviously address other diagnoses or complaints the patient presented with. for example, the edema. So we're going to start hydrochlorothiazide 25 milligrams daily. You can finish your thorough A&P, but keep it brief and do not put extra things there. For prescription orders, these are going to be new meds that were started today or that need to be filled today by our pharmacist. So you're going to put lisinopril 20 milligrams. Always, always include the number of tabs, the route, the number of pills to be dispensed, and the indication. This is very important, and our pharmacist will be following up with you to make sure that all of this information was actually completed. You should also include the frequency, for example, daily. This is a thorough and complete prescription order, and you must include all of these factors. What's different from prescription orders and medication list is the medications, again, are the running list of all the medications that the patient is currently on versus prescription orders are what is being filled today. You can also go ahead and put in the labs you'd like ordered today internally, and if on a rare occurrence you had external labs, you'd put them there. Then we'll go ahead and press save. Uh-oh, the note did not save. You know that because you're still on the note page. Because we did not update the allergy heading, the note says, please delete the heading and update contents as necessary. So this is just a reminder. This is what it looks like if you do not highlight and delete the heading. And that is proving that you have looked at all of the history fields and thoroughly updated them. Same goes with review systems. Same goes with physical exam. Now I'll scroll to the bottom and press save. I know that my note is saved because I am back on my patient profile. If I wanted to view that note, I would scroll down and go to Workups. I would press the note. And now that I'm here, I can choose to update the note. And now I have the ability to make any edits. If I'm still working on my A&P or anything like that, I can make edits. I can create an action item, see the video on action items for more details. Or I can review the note. So at a glance, what they're there for, the full H&P, the full physical exam, and then your discharge information. Please see the general overview video for more details. You'll notice that your workup is unattested. This is the point where you would go tell the physician that they need to sign the note. Once the physician has attested the note, you are unable to update it. However, you can always add an addendum. Please see the video on adding addenda for more information on that. And that is how you create a new workup.